listen to your stories, I can definitely relate about the experience. A day in the life for me is because it's difficult. It's definitely difficult, but
yeah. Mm-hmm.
Yeah.
Hi, Mreckle. How are you doing? Thank you for tuning in. How was your day? Hi, Grace to me, 623. How are you doing? Thank you for joining in. Oh, let me go ahead and pin this. How was your day, guys? All right, so tonight it's gonna be a little bit different. I am gonna try. Okay, nice, Grace to me. Yeah, my day was pretty good. Was a little bit busy early in the day, but then, you know, kind of wind down really nicely. When I got home, I was like super tired, fell asleep on the couch after having dinner. And then I'm like, all right, let me rush and try, you know, get ready for this live. But it was good. How about yours? Hi, everyone. Welcome, welcome, welcome. Thank you for tuning in. So I'm going to pin a number on the live, so persons can go ahead, feel free to call in and share your day, your story, whatever it is that you want to talk about. But it's more about, you know, a day in the life of. So if you're an engineer, you're a nurse, I would love to hear from the nurses as well, you know, because we have a lot of excitement going on in our schedule, you know, or shift at work. So I'm gonna pin that in the chat here. What area are you in, Grace to me? And Miracle Thrash. How was your day? So the number is gonna be, what's my number? Goodness, that's bad. Stacy. So the number is gonna be 469 655 5152. All right, so you can call in on this number. If you have WhatsApp, you can WhatsApp me on this number as well. And all right, so that's the number, and I'm gonna pin it. All right, so yeah, Alabama. Okay, nice. All right, so if you want, you can go ahead and call in. I have a young lady who is planning on calling in later on. She's a nurse, and she's gonna be sharing a few things with us. So hopefully she will get a chance to, you know, hop onto the live. So yeah, do we have anybody from Jamaica here? Remember to go ahead and tap on the screen, double tap the screen to, you know, give the video a like, a thumbs up, okay? So today when I was working, well, I've always considered it, but today I was at work and I had a patient And apparently she does get a bath, like, once per week. So I wanted to kind of touch on that topic. How often, wherever you're from, how often, oh, Grace to me is in New York. How often do you guys, shower, have a bath? In my culture, where I'm from in Jamaica, we take a bath probably 2 times or 3 times per day. So I want to know, what are your thoughts on that? How often do you guys find yourself showering, and what are some of the reasons you're thinking, persons do shower once or twice per week? Because that was another thing that was shocking for me when I moved to the States here, especially when I was in, up north, where it was a little bit colder. Sometimes I would be like, okay, I'm heading home, or it's a case where I am like, all right, I got in for work, and I would say that I got up from 5 o'clock to start getting ready for work, and I'll hear people say, why do you get up so early? And I'm like, well, I have to get a bath. And they're like, you shower in the morning. And I'm talking about like nurses, people in the health field. So they'll be like, you shower in the morning before coming to work. And it's the same thing. When you're leaving work, some persons are like, oh, they're going home and they're just gonna head straight into bed. Some persons will be like, and they'll brag about it, So it was like I guess it's a norm for a lot of persons, and it's dependent on where you're at, because when it comes on to persons living in like Jamaica, or Texas here, where the temperature is a little bit warmer, you might find out that persons probably shower a little bit more because it's hot, they're sweating. So some of those are reasons why they probably take a bath, an extra bath, versus persons in the cold probably thinking that, they're not sweating, so there's no need to get a bath. So that was just it. So today when I went in, I was having a conversation with a patient, because that patient hasn't had a bath. Well, it's an elderly person, so they have like an aide that comes in once or twice per week, and they'll get a bath once per week. And I was like, only once? That's just not, not good, because these persons are like, a lot of them are incontinent, and yeah, having a bath once a week is just not enough for them. So I just wanted to hear what your thoughts are on that. And I notice I have 7 persons on the live. Can you go ahead and identify yourself, please? I noticed that Miracle is here, or Grace is here. And do we have anybody else here? Remember to give the video a thumbs up as we go along. And if you have anybody who is, interested in sharing their story, whatever story it is, related to nursing, anything that will encourage persons, or just kind of give us an idea as to a day in the life of that individual, then feel free to go ahead and share the number. They can text me, or whenever I'm doing my live, they can go ahead and call. And I have an interview with a Nigerian that I am going to be uploading. So I want you guys to hear her story, so look out for that video. And as I say, a lot of the videos will be mostly, audio with those persons, because some persons just don't like the camera. So unfortunately. All right, so Grace to me, if you're still here, in New York, what is the norm? What is the culture with persons taking a bath down that side? Do you find yourself having a bath every day, or 2 times per week, or once a week? What is it like? I don't think probably she's here. Okay, yeah, so the climate is one thing that contributes to why persons probably take a bath, as I say, once, twice. And another thing is probably their busy work schedule. Grace to me says, I am Jamaican but raised in New York. Okay, so yes, once a day minimum shower, but I realize no, being a mother of 3-year-old, that often Of a 3-year-old that often children have bath days. Okay, so she's a Jamaican, so it seems as though she, her regular thing is a bath per day, the minimum. Okay, that's good. That's good. I know, and the thing about it is that I'd met a few other persons, like after they get here. Okay, other children. Okay. When they do get here, I think because of the culture, they just literally switch over to, adopting to the American way, and forget about what they used to do back then. So, but I cannot go to my bed. I can't find myself leaving work, especially the kind of work that I do, and not taking a bath. Even if I get off a shift at 2 o'clock, head home, and it's like 4 o'clock, I'm still gonna get a bath, even though probably I get up at 5 o'clock or 6 o'clock. It's just like a routine. Once you step outside, you get back in after a long day, you go in and you shower, and that's it. But when I hear persons say, hey, well, I went home and I slept, they got up in the morning, and it's the same makeup they're wearing. The lashes are the same, and you can see the mess on the lashes, and don't let tell you that, oh, I just wipe my eyes or rinse my mouth. And I'm like, these are young people. I'm not talking about like elderly folks, who are not able to do certain things. These are young people, young professionals who you're thinking, would have a boyfriend, a husband. Hi, Binesh. Hi, welcome, welcome, welcome. Thank you for tuning in. Remember to go ahead and double tap on the screen. Yes, Binesh, you can sub. Subscription is free, so go ahead, subscribe so you can see the content, once they're posted. All right, thank you. So these persons that are, making mention of not having a bath, especially at the hospital, are usually staff. I haven't met much in Texas here saying that, but as I say, in the northern section, that was a thing I realized. They'll come and be like, oh, I haven't washed my butt crack in like 3 days. And I'm like, okay. Or they come in and, their face is all messy and yeah. All right. So as I said, okay, thank you, Binesh. Thank you. Really appreciate that. Thank you for doing that. So that was another thing. So their work and lifestyle is another thing that persons use as an excuse or a reason, let's just say, not an excuse, a reason for not, taking a bath that often. And another thing, as I say, it's more of a cultural thing as well. So culturally, a lot of probably Americans probably take a bath probably like say once or twice per week, and it is okay, or a bare minimum of probably like once a week. But you have other persons who will definitely do otherwise. No problem, Binesh. Thank you so much for tuning in. Thank you so much for tuning in. All right. And as I say, if anybody is here who wants to, call in to share their story, tonight is the night where, you can share your day in the life of. If you're a nurse, I want to hear what your day was like, or just give me a brief, or the viewers, a brief, summary of what your chaotic day was. All right. And even if you're not a nurse, if you're a teacher, electrician, farmer, whatever it is, I'm sure there is a story regarding your day today. So go ahead and call in. Oh, let me see. Grace says she's trying to call in. Oh, let me tell you what happened, Grace. Let me fix it. Let me fix this. My bad. I totally forgot this. I used to get a lot of spam calls, and so I went ahead and how do I go ahead and do this again? Where did I do that? Let's try calling again. Oh my word. Let's try again, or call me on WhatsApp. If you do have WhatsApp. I'm trying to see. Caller ID, incoming calls. Silence unknown callers should have been off. Okay. Incoming calls. Let's try again to see if that goes through. Grace to me. I totally forgot that. I put it on. Oh, it's on this phone. Fine though. You're fine here with the, and if you use the Google number as well, that's okay. All right. So either one is okay. All right. So how are you doing, Grace to me? Nice to finally put a voice to the messages.
Likewise. I'm doing good.
Okay. Okay. Let me turn this up so persons can hear a little bit better. So you're in New York right now?
Yes.
Okay. And you're a nurse, or what area are you in?
I am an NP.
Okay, nice, nice.
Yes. I also do house calls.
Oh, okay.
Yeah.
Okay. How long have you been a nurse?
Since 2017.
2017. Okay. Okay. So what area of
Yes.
nursing were you practicing in before?
I started off in a doctor's office for less than a year. Then I was in the ER in a trauma center. And then I went to ICU, became an NP, AGNP, in primary care. And now I'm part-time NP and also in CRNA school full-time.
Okay, nice, nice. That's exciting
Yes.
regarding the CRNA program, right?
Yes, thank you.
Okay. Let me just ask. So, persons, if you're hearing properly, I have Grace to me here. She's a nurse practitioner. She's a Jamaican living in New York. So, we're just going to be having a little bit of talk today. So, if you're hearing the conversation with her, please just go ahead and put it in the comment section that you're hearing properly. All right, please. So if you're hearing the conversation well with her, just go ahead and put it in the comment section. All right. And what I'm gonna do, I'm gonna record your the call. Okay.
Sure.
All righty. Okay. So you can go ahead now, Grace to me. So you say you've been doing emergency room. Now you're NP, and you're also in CRNA school as a full-time student, or
Yes.
okay, all right. So tell us a little bit about your journey, why you went into nursing, why you went into nursing.
I would say nursing chose me.
Okay.
That's what I like to say. Honestly, I was in like the counseling. They have like career counseling centers in schools in New York, and I had graduated high school early, so I kind of just landed in college.
Okay.
And the counselor was like, what do you see yourself doing? And I told her like what kind of things I wanted to do, to teach. I wanted to be like an advocate, and she was like, nursing. And I was like, oh, okay. So I pretty much just jumped right in. I didn't realize how rigorous it would be.
Okay.
I was a little bit startled by that. But yeah, pretty much from there on, I just continued to go back to school, do like clinical instructor in schools and so on. And it's been good.
Okay, nice, nice. So you studied in the US here, right?
Correct.
Yes.
Yes.
Okay. And did you thought at the end of the program you were well prepared? Because I know, well, a lot of students nowadays, they will say that they're in nursing school, but they're not doing that much of a hands-on. How do you find the program at the time when you did it? Did you think you were fully equipped with the skills to function as a nurse?
Not at all. But I just feel that it's somewhat of a standard thing, I would say, because the material is so dense.
Okay.
That it's hard to feel more prepared. So sorry, I have my daughter here.
No, you're fine.
But no, I didn't feel very prepared, but I felt well trained on the job, especially in the emergency room. I think the orientation was really good. So it helped to bridge that gap.
Okay, good. Because my program in Jamaica, and I did make mention of it in a few videos, it was a little bit different in comparison to the US here, where, we do a lot of hands-on. So once you're finished, once you're finished, you feel a little bit comfortable, going in the workplace and doing your thing. Yeah. And so tell us a little bit about, your NP journey, what your day is looking like. Because I know I share my story, with my experience as a nurse practitioner. So you're doing house calls, kind of telling the folks here what it is like from another person, what that is.
Definitely. When I listen to your stories, I can definitely relate about the experience. A day in the life for me is more so, ours is more like preventative care. We don't do much treatment. But I do find in my role, there's a lot of like case management. And I don't know if you have that same experience, but pretty much a lot of phone calls, referrals, And sometimes the conditions are so disheartening. And I find myself having to like debrief a lot of times after leaving, just trying to get myself together. But pretty much I see like on average, for my 10-hour days, I see about like 7 to 8 people a day. Because the territories are kind of far apart. I don't know how it is for you in your experience, if they kind of like keep everyone together. But for ours, it's more so like wherever the needs are. So we travel a lot. Sometimes I can drive 2.5 hours to 3 hours a day.
In total to see the 7 patients that you have, or?
Yes.
Okay.
So, but overall, I do feel like it's really impactful, and I do enjoy it. But I do feel it's a bit, it's hard. It's one of those roles where you want to do more and you just can't.
That's so true. Yeah.
Yes.
That is so true. Yeah, with my company, so I have the option of, booking my own patients. So I take up that opportunity, because when I do that, I feel as though I am not wasting too much time on the road, in terms of the wear and tear on my vehicle, because I tend to group them in one, like in one zone. So for example, I'm going into Dallas. I try to see the patients in that area on one day.
Okay.
So even though it might take me probably like say 3-4 hours to see everyone, the drive time in between sometimes are a little bit like, say, 10 minutes, 15 minutes. And so unlike if sometimes the company do go ahead and book the patients, the drive time can be between 30-45 minutes sometimes, because of where the needs are. So yeah.
Gotcha.
And then today I went in, as I say about the whole experience. When I went in today, it was more of, I had a patient who, hi Bernard, thank you for tuning in, and Denzel. I had a patient who this is the first time I was meeting him in person, because last month when I saw him, he never wanted an in-person visit. And so I said, all right, you know what? I'm going to try and see him today. And when I went in, it was the same situation, the living condition was just like, sad. It was an apartment. I walked in and everything was all over. When you talk about lunch boxes for days, and then he has a wife who, not a wife, a sister who was in rehab, and she is, immobile as well. So you have 2 persons living in a home, just sitting, eating, putting things right beside, and you just have like shelves of, quote unquote garbage all over. And then not to mention, there were like roaches running around. And I'm like, oh my word, how can persons be living, living in this kind of situation? So it is very sad a lot of days, just by the population and what we are having to deal with. Okay.
100%.
Okay. So in terms of, your day, how do you normally, in terms of coping? I know you say you do a lot of debriefing. What kind of, how do you handle your stress levels, throughout the week or the day, working as a nurse practitioner or as a nurse?
I would mostly say my faith. It definitely helps me to like just renew my mind every day. And honestly, it has put me in a position of gratitude, where like I could have a rough day, but I find the goodness in so many things.
Exactly.
And I think that's what House Calls has done. It has humbled me so much. And yeah, and I try not to take it personal. But sometimes it takes a couple hours not to take it personal, because it's difficult. It's definitely difficult, but yeah, I just try to stay grateful.
That's so true. Yeah. Because a lot of times I go in, sometimes in as much as you probably want the patients to be doing this and they're not able to do it, and then it's like you're educating them, but then they're getting upset, at you. You just have to kind of, understand from their perspective, what's happening. So it's very important that, you just have to think, as if you're in the patient's shoe at all times, and just understand them. So forgive them at times whenever they get upset about certain things.
Exactly. And oftentimes, like sometimes I have patients who are really resistant when I come in, even to the point where I have to ask myself, like, am I safe here?
Ex-
And just being just being compassionate.
Mm-hmm.
At the end, a lot of the times they apologize.
Yeah. Mm-hmm.
And that's like really trying to stay objective, not take things personal, and don't treat people how they're treating you, because you don't really realize the full scope of what's causing their behavior.
Yeah, that's so true. And then the other thing I realize sometimes with a few of them, I don't know if you've encountered, if it's a case where they've had, previous experience with other providers or persons coming
Yes.
into their home, and not saying that they're judging them, but in terms of the treatment, it's probably a little bit different. Sometimes you'll hear they talk about how persons speak to them. So I think
Right.
with that as well, they kind of give you a standoffish kind of behavior, or sometimes they're
Yes.
just like a little rude, disrespectful towards. So, but after
Definitely.
you get to know them, interacting with them, you really see a different side to them, because sometimes they just need somebody to listen to them.
Of course.
That's it. They just
Of
want somebody
course.
to sit down and talk with and just listen to them. So, yeah.
That's it. Can I ask a question
Sure.
about something I often encounter, and I'm still figuring out how to deal with it?
Okay.
Sometimes I have patients where I have identified, like, for example, a diagnosis that is considered somewhat sensitive, and I'm trying to educate them, but it can become triggering. Like, for example, one thing that we have to address, I don't know about your role, is like the alcohol use. And you will address it, and sometimes in their home you realize that you're stepping on toes, but then you're kind of like wondering, should I leave it alone? Another one I had the other day was heart failure. I assessed the patient, and all the clinical symptoms said heart failure, the medication said heart failure, and when I mentioned it, they got so livid.
Yeah.
So I find myself in the situation like, is it safe for me to go ahead and have these conversations in the home? You know what I'm saying?
Yeah, I totally understand. Especially the alcohol use and the drug abuse questions in general. When you talk about them, they tend to get a little bit offensive. But one thing I always do is try to just look for the exit. Try to look for the exit, make sure I know where to run. But I try to still, try my best to bring across the information as best as possible, that's all I can do. Try to just bring across the information as best as possible, educating them and not letting them feel as though I'm judging them, that kind of way. Because some persons, you might be educating them and they take it the wrong way. So I try to just explain it to them and try to link it back to what their condition is, make that correlation with both things so they can understand from our perspective why we're discussing certain things.
Thank you.
All right, no problem. So let me hear about your CRNA. Let's jump into that part if you don't mind. How is that going? Well, hold on.
It's going good. I'm really happy with the decision to move in this direction. I'm still in my first year, but towards the end of it. So at first I thought I would have to choose one career or the other, but I'm seeing with learning where the needs of like primary care and acute care can be bridged. So I'm a baby in it, but I'm happy with my decision.
Okay.
Definitely.
Okay, I'm so proud of you. I'm so excited that, I, well, not personally know someone doing it from Jamaica, but, we have a relationship now. We're family. So,
you said you know someone that does it?
No. I'm saying you're the person. No, yeah, my go-to. Because I have a friend who, thank you everyone for tuning in. Please remember to give the video a thumbs up. All right, tap on the screen, double tap on the screen for me. But I have a friend, I did put out his video the other day where he studied math in Jamaica and Tech. And I think that's what he wants to do. He wants to go into the CRNA program. So at least, now we have somebody just in case, he has any questions. I can say, okay, then I have a friend a family on my channel, family member on my channel who you can actually relate to if you need any questions answered. Yeah. But it's nice though.
To actually text to do a more like formal interview, because I'm happy to talk more about it if you would like.
I didn't get that part. Sorry.
I've been meaning to text this number if you wanted to do like a more formal,
of course,
video interview in the future. I would be happy to.
Yes, I am open to that. So the channel, I really want to have, persons showcasing their face as well, meeting the person behind, the profession or the voice itself. So I definitely want to do face-to-face for persons who are able to, but other persons who are not able to, then the audio is fine. But definitely, I would love to take you on
of course.
to
keep in touch.
Yes, I will definitely save your number and we'll keep in contact regarding this as well.
Perfect. And I just want to say you're doing a phenomenal job. Your channel is so impactful and I enjoy your videos. So please continue them.
Thank you so much. I tell you, you know that I'm very shy though, right?
I can't tell.
Oh Lord. Yes, when I started out, or every time I'm supposed to do a live, or when I post a video, you wouldn't know how my heart is going.
Oh my gosh. And that's why I said, let me call in, because I want to support. Like, I wanted to be a little bit like in the background, just watching, but I know how it's important to like let people know, like, I see you, I hear you. So I said, let me just call in really quick. So I'm happy to be here.
Thank you. I really do appreciate you doing that. I really do appreciate you doing that. Yes. How old is your child? Just curious.
She's 3.
3? Okay, nice, nice. Mm-hmm. Only child?
Only child, yes.
Okay,
it's
so
myself and my husband, so we're juggling that.
Okay. So well, one question. How do you balance, balance CRNA school, full-time, working as an NP, and a mother and a wife? How do you do that?
Honestly, I have given myself grace. Funny enough is I was a type A personality, like in nursing school. And I always say the ER was a gift to me because it had to calm me down to learn that, sometimes you just have to go with the flow. So now I have like a balance between like extremely efficient, but also just going with the flow.
Okay.
So I think it equipped me for this stage in my life where my schedule is very meticulous. Like my husband and I have an Apple calendar and we know what's happening hour by hour.
Okay.
But otherwise, I give myself grace the days that I can't perform as I want to. I tell myself it's okay. But it has been panning out well. Surprisingly, I'm finishing up my second semester and I have all A's. I mean, to God be the glory.
Nice. Congrats.
While working, and I thought that I wasn't going to be able to work and what have you. So, yeah,
because a lot of times you hear persons talking about the CRNA program, it's always full-time, and you find out that persons are still not working with it. So it's good that you're able to, be doing the program full-time, working, and still getting good grades, as you're going through. So that's really impressive.
Thank you.
Yes, that is really impressive.
And she's in school full-time, so that helps too. She's in preschool.
Yeah, that's what I had to do with my little boy at the time when I was not in school. Because when I was in school, he was, still a little, little toddler. So, but yeah.
It's not easy.
Yeah, we had to enroll him in school from early just to kind of help with, balancing out a bit our personal life.
How old is your son?
He's 6 years old.
Oh, okay.
Yeah, 6 years old and very active little boy.
Oh my goodness. I can't even tell that you have any children because you're just so you have it together. I don't know.
Oh my word! Thank you.
You're welcome. I feel like people can tell I have a child because I'm just looking like I'm just here.
Well, you have a lot of things going on, but at the end of the day, you'll see the results, and I'm sure it's not that bad as you think. Yeah.
Thank
So,
you.
so
All
it was
right.
really nice. It was really nice. It's what time now? Around 8:40 in New York now, right?
That's right. Yes.
Okay. How is the weather?
It's it's warm today, warmer, like
Okay.
60s, but it's really rainy.
Okay. Oh, yeah.
Yeah. How's
Okay.
it in Texas?
I think it was like say 49, 50s today. So it was
Okay.
a bit cold when I was doing house calls. I was like, okay then, if it's this cold tomorrow, I'm probably gonna
Yeah.
be staying in because can't do it.
So you really have flexibility in that way.
Yes, I do have a lot of flexibility. I love flexibility because even when I was working
Right.
after, traveling and the contracts were usually like say 3 months. So it was pretty
Yeah.
nice for me and I enjoy that because I still
Yeah.
have time to, take my little vacations without anybody complaining that, oh, you're gonna be off for too long, so
Right.
and so I just get into the habit of just doing, travel contracts, local contracts, and then PRing. And I just enjoy the flexibility of it. So with the house
Nice.
calls, it is even better. And then with my company, she is like the sweetest person. So once I'm producing results, patients
Yeah.
are happy, I'm good. She's good.
I
So
love that for you.
yeah.
I love that.
So that's where I'm at with it.
Very nice.
Yeah.
All right.
Alrighty.
So
Well,
to be continued.
of course, to be continued. But in the meantime,
Yes.
just give me one word of encouragement for somebody who is a nurse, in school, thinking about the whole journey, or, they're having doubts because of multiple reasons, personal reasons. What is one thing you can say to them right now to just encourage and uplift them?
Okay, I will say something that someone told me when I was in nursing school, and it sticks with me till this day. It may seem simple, but they told me, you work hard now, you play later.
Exactly.
And that really has motivated me and pushed me because honestly, when you're in nursing school and sometimes nursing, it feels a little bit isolating because you put in so much work and a lot of people cannot relate. So then you look around and you say, I could be working right now instead of having my head in the books. But just remember, you work hard now so you can play later, because it's either way. It's either you play now and you work hard later, or you do it now and then you play later. So it's simple, but I never forgot that.
Yeah, that's so true. That's why I went ahead and did my program. At the time when I just moved to the States, I was 1 year in, still on a contract, and I'm like, I need to get this master's out of the way because I don't want it to be a case where, I start having kids and then the brain getting a little bit lazy and everybody just feeling, So yeah, that makes sense. But then again, you have
So
to look at
I'm
it.
gonna have to go look at your videos because I don't know your journey much. I just found your channel like 2 weeks ago. So
Definitely check it out.
Okay.
Check it out.
Yes.
Please do. Yeah. All right, then. But thank you so much for taking the time out. And I look forward to another conversation with you where you're sharing more stories with us.
Yes. Thank you so much for having me.
You're welcome. Enjoy your day now or your night.
All right. Thank you.
All right. Bye. All right, so there we have it, folks. This was Miss Gracie, and she is a nurse. She worked in the emergency room. She also worked in ICU, and she's currently living in New York. She's from Jamaica, so she did, her nursing duties, and then she's actually working as a nurse practitioner now, doing house calls, something similar to what I'm doing, visiting patients in their home. And she did explain that, so just in case you miss it, And then she's also full-time in CRNA school. So that's like, a total different world of nursing in terms of, the education, the program itself is so extensive. Usually they don't require or encourage you to be working because of the amount of things you have to do in terms of studying and preparation. But she's doing that full time, but yet still she's able to still find the time and work as a nurse practitioner. She's doing excellent. She says she's getting, is in school right now, and she also has a child. So a lot of things going on, and at the same time, she's still, you know, doing her thing. So I'll definitely get her back on the show here, where we'll have a face-to-face and just, you know, put a face behind, put a face with the person that you were hearing just a while ago. All right. As I say, this is the time when we're literally just talking about, you know, a day in the life of. So if you're a nurse, if you're a teacher, whatever profession you're in, you can go ahead and call me in and share your story. Or if you have something regarding, you know, growing up, you know, why you went into the area of your choice, your career. Just talk about your journey itself. And as I say, it's more of like for encouraging persons, as well as to make persons be aware of certain things. You know, in Jamaica, the working in the hospital is a little bit different than working in, you know, the US here, Canada. So I just want persons to share what it is like, what their day is like in wherever you are you're from. That's all. All right. And as I said, the number you can call me on is 469-655-5152. I should have another Jamaican who is working in she's working in Indiana. Hopefully she'll be able to call in tonight, and she will share with us her journey as well. All right. But in the meantime, remember to give the video a thumbs up. Any questions from anyone? Binish, I saw you. You're here. Thank you so much. Max up at AKA Cookie Lily. Just buzzing what is happening here. Hope you did heard what I just explained a while ago. All right, I want to say thank you so much to everybody for tuning in. Marvin Lee, yes, thank you so much for tuning in on the channel here on the live. And Denzel Palmer says, hello, beautiful. What's the program of the night? Hope you're still here, and you hope you didn't miss out anything with Gracie sharing her story. Welcome, Unbroken. Thank you so much for tuning in. And, you know, as I say, remember, just give the video a thumbs up. RN to CEO is here. Awesome call. Yes, RN to CEO. Do you want to call in right now? And RN to CEO is a nurse as well from Jamaica. She's a coach, a nurse coach. And she has a channel that she shares like motivational, you know, tips, things about self-care that you can actually go in and listen to and share in on her channel. All right, so it's RN number 2 CEO. So when you get a chance, go in to her channel and just explore a little bit. She says go in, driving in a bit. Okay, no problem, no problem. Well, drive safe, drive safe. Oh, there. All right. Yeah, so as you can see, you know, the life of a nurse, or the day in the life of a nurse, can be very hectic at times. It is very hectic. And depending on what area you're in, you know, it comes with its different challenges. You know, house calls might seem easy, but then when it comes on to, you know, it taking on that emotional side of you, or, you know, it's something you have to think about. You know, nursing is not just necessarily for everyone. You have to have a love for it. You have to have a passion. So don't go in it if you feel as though you're just going in for pursuing that career because it's a safe job or something like that. You know, no. Make sure you love what you're doing, because every area in nursing has its own challenges that comes with it. So if you're ICU nurse, you're going to have to deal with all of those alarms and the multiple drugs and, you know, seeing patients most of the time just being sick, like really, really sick, critically ill. So just remember that. But as I always say, just go in and give your best shot at it. And remember to put yourself in the patient's shoe at all times. All right. Thank you so much, everyone, for tuning in. Do we have anybody else who would like to call in to share their story with us? The number, I went ahead and pinned it there, so you can go ahead and call if you're in Jamaica, or if you don't have, you know, access to calling the number, you can feel free to, well, not WhatsApp me tonight. I'm going to have to switch over on this phone with the WhatsApp. I think the WhatsApp is on this other phone. Yeah, but how is everyone's night going? You're welcome, Grace, to me. No problem.